my show. And today our guest is Dr. Shakti Singh. He is head, neck, and oral cancer specialist from Ahmedabad. We already spoke a lot about oral cancer in our previous episode, and we will be continuing to talk about it. And we will touch base the major oral cancers that happens, including throat cancer, thyroid cancer, and voice box cancer. So, welcome, doctor. Thank you so much that you spared more time for us, and I would like you to have you here even more time. So, what is throat cancer, doctor?
Thank you. First of all, I would like to thank you for inviting me and making this podcast for the awareness of general masses, because that is the now a voice which can reach to the bigger the
The masses,
masses.
basically.
Because ultimately, when we talk about cancer, it is the lack of awareness is taking more lives, and this kind of podcast will definitely enlighten their knowledge, and not only the even the family members also will be aware about if they have any issue in their family. They will take the right step at the right time and probably the save lives. So thank you for your effort, and thank you for inviting me, and for my sharing my views on the cancer. Thank you so much.
You're welcome, sir. So, we were talking about throat cancer.
Yeah. So today we are going to talk about the throat cancer, laryngeal cancers or voice box cancers, and thyroid cancers. So throat cancer is bit different from the oral cancer. So when we talk about oral cancer, it is the kind of the region which we see in the oral cavity. So it is lip, upper the jaw, lower jaw, the tongue region, the floor of mouth region. Now there's a more region behind the tongue, so that is called as the oropharyngeal region. That is we call it the throat cancers. Now when we talk about throat cancers, there are two aspects. One is we'll have some primary from where the tumor starts, that is called as the primary,
Right.
and the tumor spreads through the neck node lymph nodes. There are
Okay.
small lymph nodes are there in the neck.
Is it similar to that of tonsillitis? If I just want to
Yeah,
clarify that,
you're very correct.
I'm correct?
Yes.
Yeah.
So what happens if there is a tonsillitis, if there is an infection in the tooth, in gums, lymph node will get enlarged,
True.
and the infection subsides, it regresses.
Right.
So the principle of the lymph node is they produce antibodies towards whichever infection is there in the body. So like that we have thousands of lymph nodes in
In the
our
body.
body.
Yeah.
So neck lymph nodes are increased in size because of the metastasis. So if there's a tumor in the tongue or in the upper jaw, the lymph node will get enlarged.
Okay.
So first sign which everyone could see is, everyone have a mirror in their house, they can see, or their relatives will look into their face and they can make it out, because
Yeah.
it's all area is exposed area.
True.
If even a stranger can come and tell you, "Arey, you have got some swelling, kya baat
क्या
hai?
हुआ? What happened? What
What
happened? Why you
happened?"
have a swelling in that region?
Exactly. So what happens is, it's a very visible area. Yesterday we talked about oral cancer is a visible
It's
cancer.
one of the
So
visible
any
things.
swelling in neck,
Yeah.
that should be evaluated for any kind of oral or throat cancers. So first thing is the lymph node or any swelling that should not be ignored.
Okay.
Now swelling can be benign, we call it as non-cancerous, and it can be cancerous also.
Okay.
See, I usually give this my example. I'll give you a small example before we move on to the throat cancer, specifically the causes and the
The
treatment.
causes and the treatment. Yeah.
So one of my friend, he's practicing in Mumbai.
Mm.
He is the dentist for the children. Okay,
Okay.
so he's a pediatric dentist. We term him as. He was treating a pediatric patient around 12 years of age.
Mm.
So he was making some root canal treatment in the tooth. So while the child was very anxious, it's a different ball game to manage, especially the children for the
Yeah.
dental treatment.
Absolutely.
So he was trying to, stabilize the child, trying to, bribe him with some chocolates, trying to touch ki yahan kuch nahi hoga, no problem, I'll manage it like that. So he could feel there is some lump in the neck
For that
while
for that
for the
12-year
12-year-old
old
child.
child.
Now he finished the root canal treatment, and coincidentally I just called him in the evening just for some work. I said, "Kya chal raha hai? How are you?" and all. He shared with me that, yeah, today I got a child
Hmm.
who has got a lymph node on other side. I mean this side.
And
Patient had
and
a
he was
tooth pain.
treating the other side
Yes,
of
so
the jaw,
patient has a
right?
problem on the left side, lymph
Okay.
nodes for the left right side. So he was, a bit surprised ki if there's infection on this side, the lymph node on this side should
Absolutely,
enlarge.
absolutely. Yeah.
So he just said, "Yeah, Shakti, I just wanted to know कि ऐसा क्यों होता है?"
Hmm.
I said, usually it doesn't happen that because of infection, the lymph node of other side will get enlarged.
True.
So what you need to do is, you need to reassess the patient. Once you finish off a dental treatment, don't let the patient go. Reassess the treatment. So simple, get a sonography done. Nothing doing such big things. Sonography is it literally a painless, non-invasive.
We can do that for kids.
For kids, it
It's
can
safe.
easily be done. A
Okay.
sonography, just they need to put a probe and see what is there
Mm,
inside.
okay.
So when the child came next time, they did the completed treatment, and before they send off the child, he called the parents and he said, "Here, why don't you get investigation done, a sonography for this lump, because this is not looking normal,
Not an usual one.
usual
Basically, it
one."
was an unusual lump.
Yes.
Okay.
So he has been referred for sonography. The sonography person have connected with me ki I feel there is some problem there. We should do some testing
Further
from,
testing.
yes,
Some
for that.
further testing to investigate it
Yes. So then
further.
and there, right, when he was doing the sonography, I advised him to take a small sample with a needle,
Okay.
and he was diagnosed with a lymphoma. It is a kind of blood cancer.
Oh my God, that's scary. That's really scary.
He has been treated for that cancer, and the child is happy. It's almost 7-8 years now. So this is, there's a learning, there's an experience that we need to share, that no lymph node in neck should be left unattended or ignored.
Rightly said, doctor. Rightly
So
said. And
lymph node enlargement is one of the thing we should look
one
forward
of the
for.
symptoms
One of the symptom.
for an underlying condition.
Yes, and that is the sad reality, that when I see my patients here in Western Rajasthan, because I almost cover Jodhpur, Jaipur, Pali, Jalore, all the districts. I almost work in 11, 12 districts. What commonly I have seen is people ignore the swelling till the time it become a bigger, bigger and bigger,
True.
and surprisingly, the family members also doesn't care about it.
True. They think that it must be something minor, and let's
Yes,
just
it is, until unless
it
it
will
is
be
not.
all right within few days, and let's just focus on something else. And that
Very
kind of
true.
temperament is, as you earlier mentioned, that a cancer which is stage 1 and stage 2
Yes.
is still treatable, but any
Yeah.
cancer which goes to stage 3 and 4,
It is difficult to treat,
survival
survival is
is
compromised, difficult to
compromised.
treat, your quality of life decreases. So there are a lot of issues with that. So we need to give this message to the each and everyone, that in your family, if you find your family member having these kind of problem with some swelling, maybe it is non-painful, it is not troubling your relative or your family
Yeah,
member, but still that need to be evaluated.
very
Do not
important.
ignore that.
Do not ignore
Do
even a
not
very
close
very
your eyes.
small symptom that you are
Correct,
facing, whether
correct,
it's you or someone in the family.
correct.
Right, doctor? So what happened to the child? I'm curious to know. He
No,
was treated well.
he was treated, as I said, he was
Hmm.
treated with chemotherapy, and because that is the lymphoma, or as I said, blood cancer, it's a type of blood cancer which
Okay.
requires only chemotherapy,
Okay.
and he was treated with chemotherapy, and because he was an early stage lymphoma, it was not metastatic to any of the body region, so he is treated and he's all doing good.
Was it a stage 1 for that
Yes,
child? Okay.
yes.
Quite safe
Quite safe. So that is the reason that our whole target is to diagnose the patient on
at
early
the right
stage
time.
and right time.
Very true,
So when
doctor.
we talk about the throat cancers, now we'll come to our topic, because this is a story I wanted to share to the your
Audiences
audience, so
here,
that
so
they
that they
understand
understand
the
that
importance of
and how critical it is.
how
Imagine a
critical.
small child. No one will expect this because people think, अरे ये तो बच्चा है, इसको कहाँ से
इसको कैसे कैंसर हो?
इसको कैसे कैंसर होगा?
Exactly.
That kind of temperament and mentality people have. But cancer is something anyone can get it at any point of time,
Yes, it can
right?
be a 6 month baby, or it can be a 60-year-old.
Yes,
You never know
absolutely,
which when you
absolutely.
develop this kind of
We
cancer.
never
So
know
we should
because
not relate with the age factor.
Right. Absolutely.
So that is why I've shared a small story about it. Now we talk about the throat cancers. Throat cancers, I mean to say, the cancers of the oral cavity behind the tongue.
Behind the
This
tongue.
behind the tongue region, which is not visible when a patient opens his mouth.
Mm.
That पीछे का जो जीभ का हिस्सा होता है
The,
वो
the
visible.
initial portion of the esophagus?
No, it is above the initial portion of esophagus and the tongue, posterior
Okay.
aspect of the
The
tongue,
posterior mouth.
posterior mouth.
The correct.
You can say the
We
posterior
can
mouth.
say that.
Yes, yes, yes.
Okay.
So that aspect is, usually we call it as a oropharynx region.
Pharynx.
Oropharynx region. So what is happening is this is commonly related to the smoking. Now in our part, now we see a lot of patients in those who are in now 50s or 60s. They had a habit of BD was very common earlier.
Very common, yeah.
The chewable form came yesterday. I said it came in 90s, but the BD is available since a long time.
Since a long time. True.
And the villagers and these people, they have very habit of having the BD.
Yeah.
Now, पहला तो हमको ये समझना है कि बीड़ी पीते क्यों थे लोग. BD actually kills your hunger.
Okay, I didn't know that. Doctor.
So many people,
That's a news for me.
yes, it kills the hunger. So the craving for having the food, it has been killed by the BD. So many people, they started, it usually started with the workers and those people who were not accessible, to the
Yeah.
3 time meals, जो
Who
काम करते थे,
couldn't afford
who
basically
couldn't
to have
afford.
a 3
They
time meal in a
started with the
day.
BD and then
Oh.
they become addicted because there's a nicotine, tobacco, so everything, they become addicted to it. So these people who are in 50s and 60s, these people come with difficulty in swallowing.
Okay.
Now, common symptom of throat cancer, if I say, first thing is difficulty in swallowing and a foreign body sensation. कि जब मैं कुछ खाता हूँ तो मुझे गले में ऐसा लगता है कुछ अटक रहा है. Because the moment this is the posterior part of the tongue, this is your this is your posterior pharyngeal wall. So when you swallow, the food is being pushed by the tongue and this wall into your food pipe.
The food pipe, yeah.
So if there's a small growth that will touch on this region,
yes,
and you will feel that foreign body sensation. So foreign body sensation and difficulty in swallowing is a classical finding of having some problem in the posterior part.
Right.
Inability to eat spicy foods और eat कोई बड़ा bite आप निगल नहीं सकते हो, उतारने में दिक्कत हो रही है. So these are very common symptoms of having some problem in the posterior part, and that is not visible even by the dentist or the general physicians. To visualize that part, we need to put an endoscope.
That's the only way,
That's the
doctor?
only way to examine.
For the examination, right?
For the examination. So we use endoscope to examine that part of the region. So many times these patients with difficulty swallowing or burning sensation, foreign body, they visit general physicians. They do not have a scope.
Yeah.
So they will give some antibiotics, some painkillers, and some.
Normally, that's what we do. Even
that is what has been done in general practice.
During common cold, also when you have this throat issue.
Yeah.
That's the.
So when they go to physician, they do not get the right treatment. So I would wish that whosoever these patients have a complaint, if they do not get a relief in 7 to 10 days, they should be referred to a ENT surgeon for
Again,
opinion.
the time frame here would be 15 days, or
Yes,
it would be less than.
We usually take
talked
2 weeks.
about it, right?
We usually take
minimum
2 weeks.
2 weeks. If you're not getting well, if it's not getting recovered,
Correct.
You need to take one more step ahead.
Yes.
For further diagnosis.
Yes. So that step is doing an endoscopy. So endoscopy for clinical examination, and if still endoscope are not available or you have some doubt, then go for CT scan. See, now CT scans are readily available.
Yeah.
Earlier probably there were few centers, but now there are so many centers. It is affordable. Just probably it's 4,000 rupees, or money doesn't matter, but it is available, readily available. You can just go get a CT scan done. Within 2 hours you will get the report.
Right.
So
most of the hospitals
not be
are
ignored.
having that facility
So
right
the
now.
signs and symptoms should not be ignored neither by the patient nor by the doctors. That is the message we want to give.
Right.
Now, when we talk about etiology of these throat cancers, mainly the oropharyngeal cancers, if we talk about. So, as I said, first they are related to the smoking, whether
Mm.
it's a BD, there's a cigarette. In South, they do the reverse smoking also.
Oh, okay.
So, I don't know whether you're aware about it or not. Though the reverse smoking is they put the that जो जलता हुआ part होता है, that portion of the bud, they put it inside the mouth.
Oh my God. So that's called reverse smoke.
That is called the
Oh my
reverse
God.
smoking.
Seriously, doctor. Seriously, what a
So
learning today. Even I didn't know this.
yeah, so that's very common, especially in the
In
Andhra
the
region,
Andhra region.
So
Okay.
they say, why do you put, we were also
Hmm.
surprised, कि क्यों
Hmm.
ऐसा करना है भाई? Why do you put like this?
Yeah.
So they say, because these people used to work in the field
Hmm.
and at times it used to rain, तो
Okay.
ऐसे पिएंगे तो बुझ जाएगी.
Oh my God.
So they used to
Seriously.
put that, but inside and
And they
keep
used
it
to
for some
smoke
time.
like in a
Yeah, so
reverse
अंदर से
manner.
जल के वो that उसका
So
जो smoke निकल रहा था वो अंदर ही जा रहा था.
so that's
They
more
don't have to.
dangerous.
That's
That's
more
more dangerous.
dangerous. Yes, of course, that's most dangerous. So that we call it a reverse sutta smoking.
Okay.
That's it's been documented in our books also. So that is one of the reason for this oropharyngeal cancers. And then one more important issue we should touch upon is the increasing prevalence of the cancer, this oropharyngeal cancer in our country is because of HPV viral infections.
Okay.
So yesterday when we were talking about the oral cancers, everyone talks about tobacco, that was all we discussed. Then we talked about the alcohol, then we talked about nutritional deficiency, then we talked about the sharp tooth, then we talked about poor oral hygiene, then we talked about the kind of uh, radiations or some irradiations also causes, and this is the missed portion, the viral
One of the major
infections,
reasons,
that
especially in Western countries
especially in western countries. So now this increasing prevalence of oropharyngeal cancers is also increasing in our country also.
too.
The reason for this transfer of HPV virus to the oral cavity is the unprotected sexual activities. So that
Right.
is that should be a make we should make our general masses aware
Aware.
that these kind of acts also
Can
lead
lead
to this
to major
HPV
oral issue,
related
which is
oropharyngeal
an oral cancer.
cancers. So this is all about the the throat cancers, the reason for development of these throat cancers, and the investigation. As I said, the endoscopic examination and the CT scans remains the standard for the diagnosis, that is followed by some kind of tissue biopsy, because every cancer we treat,
We have to do the
we
biopsy.
have to do a small biopsy to document it with the proof that this is
Is
a
a
cancer.
cancer. Without the biopsy, we can't say. Just by looking at it, it
No
cannot be
CT
proved.
scans, no
Right.
PET scan can can make you 100, can guide you for 100% other than
Right.
the biopsy, which we call it as a gold standard. So never hesitate to get a small biopsy done from wherever you are having it,
If you have a
the
doubt, if you have
symptom,
a
or
doubt,
wherever
or
there's
if
a,
there is a, the
yes,
CT scan and the
and
endoscopy
small
result
small
shows
tissue.
some kind of,
Yes, the
you
biopsy is,
you know,
people get afraid, but it's a
yeah.
very small tissue, tiny tissue is taken just for diagnosis. So biopsy just tell whether it's a positive or not. It doesn't tell about staging or anything.
Mm.
So biopsy should be mandatory. Never get afraid of going for biopsy. Get your biopsy done if it is suspicious, advised by your doctor or a surgeon or a physician, and take the further treatment.
Right, doctor.
Yeah.
So once this is done, then how's the treatment? Like, how much time does it take? Is it the same process? We talk about stage one, stage two, stage three, and stage four, and normal cancer treatment is being taken care of. Like in this scenario, how does it work?
Okay, so the treatment for oropharyngeal cancers is different from the oral cancers.
That's what we want to know, and even the audiences would like to know.
Yes, so it is different from the oral cancers. Most of these oropharyngeal cancers are being treated without surgery.
Is it?
Yes,
That's a good news at
that's a
least.
good news.
There's a little bit of good news that we're hearing today on our podcast.
Yes. So
And how do
these,
we do that, doc?
so that is done by radiation therapy
Okay.
and the chemotherapy, because the oropharyngeal region, if we if we do a surgery, it is very difficult to rehabilitate that area, and patient might have long term or lifetime difficulty in swallowing. They might not be able to swallow. They might have to be on a tube for whole life. So there are a lot of quality of life issues related if you operate on these area, and the
Mm,
chemoradiation is as good as effective as the surgery. That is what our literature has proven.
right.
So if the radiation and chemotherapy can give as good as result than the surgery, then I think we should go for non-surgical option. And especially these HPV related cancers, the good news is they respond very well with this chemoradiation.
Okay.
And
And how
they,
much time does it take, like this chemotherapy
okay,
for
so the
recovery?
treatment
If we
of
talk about the timelines,
correct. So the
basically
treatment goes for 6 to 8 weeks.
6 to 8 weeks.
Yeah. So radiation, it usually starts, we give around 30 to 35 fractions we call.
Okay.
So and the patient didn't get no need to get admitted in the hospital.
Okay.
It's a daycare procedures. They just have to go to a center. It takes hardly 2 minutes. That machine runs around. They are fixed to one position. Machine runs around. They go home.
Okay.
So in chemotherapy and radiotherapy, patient doesn't need to get admitted. For chemotherapy, just 3 hours they have to be there. They just put one injection in the glucose that goes for 3 hours or 4 hours, and patient goes home.
Okay.
So chemotherapy and radiotherapy remains the standard of treatment for
And that is
these
the only option available
oropharyngeal
for the
cancers.
throat cancer, right? That
Yeah.
as you mentioned. I
Yes.
have a question here, doctor. Like if it's a throat cancer and we are going through like
Yeah.
whatever the suggestion is for the treatment, even a windpipe is just if you can clarify that, because our windpipe is going simultaneously along with the esophagus. So
Yeah.
what are the
So
impacts of this kind of a treatment, because it's just chemotherapy, and what are the after effects?
correct. So the windpipe will get into these details of windpipe and the voice box cancers when we are talking
Okay,
about it.
that's related to the
Yeah, because
next
there's a
portion.
voice box cancer, and after that the windpipe starts,
Okay.
and behind that there's a food pipe
So basically, this throat cancer region is way away.
above
It's above that
above
region,
the
and the chemotherapy is only given to that particular region.
no chemotherapy is injections.
Okay,
As I said,
it's only injections.
glucose ke bottle ke andar they just need to put an injection, and
Hmm.
that through the drip we call it as.
Okay,
So it is just a drip, goes for 3 hours and you go home.
and you go home. So that's pretty simple
Yeah,
in a way.
it is simple. It carry little bit of side effects, but usually the side effects are
So, but the side
recovered.
effects can be treated,
Yeah,
doctor.
that can be treated. That can be
Okay.
treated. And added to this, now we were yesterday talking about the advancements, So
Right.
there are robotic surgeries are available now. If we have a small lesion, very small lesion which can be treated with lasers or the robot, that also can be used. Now we are using some kind of these robotic surgeries for this
Right.
oropharyngeal cancers, but it need to be very small lesion,
Yeah, if the lesion is very small,
very small, and
which
because
can be
it is
taken out.
difficult that these kind of
Yeah.
small lesions only can be detected on the routine checkup. Patient will never realize that he has got a problem in these. So we have a lot of difficulties in diagnosing these patients on early basis, but probably with the coming time, with the kind of awareness you and we are doing together, probably we will have some people coming on early stage. Those can be treated with the robotic surgeries or the transorangeal laser surgeries. I mean trans or laser surgeries also.
Right, doctor.
Yeah.
So I think with that we have completed the throat cancer.
Yeah, we almost completed the throat cancers. The
Is there
throat can
anything
that's
that
a
you
part of throat cancer. That is a
want to add up
oropharynx is
to
a
it?
part of throat cancer.
Right,
Then that the important part comes the voice box cancer.
right. So, doctor, I think now we can talk about the next cancer that you said. So, will
Yeah.
it be voice box cancer?
Yes, it will be voice box cancer.
Because that's the
Yes.
next portion. If we go step by step.
Yes, it
So,
is very
where
related.
exactly
Very related.
the thyroid is? Is it
Thyroid comes very down.
very down?
Very down.
So
It is
it's
over the windpipe.
okay. Okay.
So it is over the windpipe. So
Right.
this is the area we call that where tongue ends,
Yeah.
and from there your voice box starts. Your voice box ends, then your windpipe starts, The moment your
Okay.
windpipe starts from fourth and fifth tracheal ring, we call your thyroid, the thyroid gland is there,
Is
the mid
there.
portion of it. So usually
Right.
your thyroid gland is a butterfly
In the
shaped
shape of a
gland,
butterfly
but in the
gland.
lower third of the neck. The voice box usually come in the middle third of the neck.
Right.
Yeah.
One more question I have here, a quick question. Like, what is the possibility of spreading a cancer, which actually happened, in the posterior mouth or the throat cancer? Can it spread to, slowly, steadily to like voice box and then to thyroid? Does that happen?
Yes. It commonly happens actually, from, like as I said, from the posterior part of the tongue.
If it is left
It is spread to
untreated?
the ears. If it spreads to the voice box. So the voice box, or it is spread to lateral part of the pharyngeal wall, we call it as so it usually spreads locally. So
Okay.
that is called local spread. And if it is metastatic to neck or the lymph node in the neck, that is called a metastatic cancer.
Okay.
And if it is untreated, that might spread to lungs, liver, intestine. So those cancers are non-treatable cancers. If it is,
We call it stage 4 cancer,
yeah,
kind
stage
of,
4 cancers, yes, stage
kind of,
4
where
is
the
divided
where the
into
cancer has
A,
been.
B, and C.
Yeah.
So these metastatic disease, which are spread to other body parts,
Right.
are stage 4C,
The last
the
stage.
last stage. And literally,
Nothing can be done,
these patients
basically.
are non-treatable patient, non-curable patients. We just give them pain and palliative and supportive care, because whatever well said and done, the technology we do will not be able to give them good survival. Overall survival remains the same.
What are the chances, like you just mentioned in stage 4, we have three further division of it,
Yeah.
A, B, and C. Is there any chance in like stage 4 A category for
Yes. Now, see,
survival?
when we talk about stage 4A is being treated. Yeah.
Okay.
Stage 4A has been
Still we
treated.
have
It is
hope.
treatable. Yes.
Right, doctor. Coming onto the point, like we were now talking about the voice box cancer.
Yes.
So, what is it? How is it? How is it like? How we can know that that this type of cancer has happened? So, any variation happens to the voice,
Of course, that
which
is the
tells you
first.
or guides you as a symptom.
Correct. As I
I'm just
said,
I'm
God
just
is,
again
God is very
thinking.
kind to all of us.
Yes, very very kind,
He
and I'm so
definitely
thankful.
will give some symptoms before
Uh,
a cancer starts, or even after starting on early
hmm,
stage, God will give
hmm,
some symptoms.
true.
We need to
We
understand the
need to
signs.
understand the science.
So when we talk about voice box cancer, the first thing what will happen is
The voice will
change
get
in the voice,
voice will change.
hoarseness of voice we call. Either there is, the
The voice will
pitch will
become
get this.
heavy, a
Yes,
bit of heaviness in the
yes,
voice
the
can happen.
voice will become heavy. There will be no variation in the change of the voice. So all these symptoms, what we spoken earlier, now also, especially for voice box, difficulty in swallowing, again I say,
Hmm.
because when there's a growth on the, as I said, there's a voice box, there's a food pipe.
Yes.
So if there's a growth, the food pipe will get compressed.
Okay. And
So difficulty in swallowing also,
again difficulty as well.
and difficulty in speaking, or voice definitely will get altered.
Okay.
So that's a very common signs. So if a patient is having some kind of change in the voice, he should get immediately examined, done by ENT surgeon or a cancer surgeon,
Yeah, which is not related to cold,
which is
like
not
which is
related
not
to cold.
related to common cold and cough.
Yes. So we give a window time. We give a window period of 2 weeks. We always say,
Yeah, we always
if
say
there's
that
a
just wait
symptom,
for 2 weeks, and if it
if
is
there's a
not getting
symptom,
treated, then
treat conservatively. Wait
right,
for 15 days.
right.
And if you think that in 15 days it has not improved, or it has not or it has worsened, then straight away they should be sent for the further
Further
investigation.
investigation on this.
Yeah.
So how do we find out, like what are the, like how do we check what are the investigations that a person needs to do who has a voice box cancer?
Okay. The first thing is the endoscopy. So every ENT surgeon and most of the maxillofacial surgeons and we as a cancer surgeons, we have an endoscope. It's a very
Right.
simple technique. It's a, there are two kinds of endoscope. One is, the rigid endoscope and one is we put the camera through the nose.
Okay.
There's flexible endoscope. So we can visualize everything what is going on inside the throat. Everything can be visualized. So that flexible endoscope works the best. And that guides us कि कहाँ पे क्या तकलीफ patient को हो रही है.
So it's visible. It's
It's
visible in
visible on
that.
the screen.
Okay.
So we put the camera, we see it on the screen.
Okay. And then again, we take a tissue and we send it for
We just do the examination.
Okay.
Then we do the
biopsy.
investigation first,
Okay.
and then we counsel the patient. कि this is what
It looks like, and
it looks
it
like.
might be.
This is what in the CT scan.
Hmm.
I have a suspicion. It can be problematic.
Can
Why?
we do both the investigation, doctor? Like, or just one investigation
नहीं,
is enough?
both are needed.
Both are needed.
Endoscopy and CT scan both
Both
are
is needed. Okay.
And
Thanks
then
for
comes the
clarifying
biopsy.
that. Thanks for clarifying
Yeah.
that. Yeah.
And then comes the treatment plan. So all the clinical examination is always aided by your CT scan or imaging.
Right.
It is a dictum, it is a rule that no doctor should treat any disease without a good imaging. Because your eyes can only read what is there on the surface. Eyes cannot read what is there inside.
Absolutely.
So we
doctor.
should not miss all those things. So it is very important that every doctor, every surgeon should always take assistance by doing an imaging and proper planning of the patients.
Very right, doctor.
Yeah.
So what's the next steps then? Once if you feel and there is something which is showing up on these reports.
Yeah.
So what is the further step? Is it again biopsy?
Yeah, biopsy is taken. It's proven now. So
Proven now that there's
yes,
a cancer
again there's a
and
staging.
you need to take a cancer treatment.
Yes, then we do the staging. Usually in voice box cancers, there are two vocal cords. So it moves like this. It closes your the voice box when you are swallowing. And when you're speaking, it opens up. So there's a voice box, and because of vibration in these two cords, the voice is being produced.
Right.
This is the function of the voice box. So if there's any growth on this voice box, your hoarseness will get, because it will not get completely closed.
Right.
You will develop a hoarseness.
Right.
That is primarily because of some growth. Now, when we talk about treatment of these voice box cancers, we go on a organ preservation. The concept of organ preservation.
It's different from that of a throat cancer treatment.
No, it's similar, but it's different from the oral cavity cancers. In oral cavity cancers, we usually say we should take it out the cancer, but here we have reservations because yesterday we discussed that nobody wants to lose the voice, and for a small cancer on voice box, we don't want patient to lose the voice.
Absolutely.
So there are two techniques available again for that treatment. So one is the surgical. In surgical, it is trans laser surgery, uh, microscopic laryngeal surgery.
Okay.
So what we do is with the lasers, we usually burn that area or take it out to the lasers. But there are specific indications for that. It cannot be done for T3, T4 lesions of
the bigger sizes.
bigger size lesions.
Again,
So
you have
it's a
reservations,
small
and again,
lesion.
it depends how
Yes.
small it is. If it is a smaller one, it can be treated.
It can be treated with lasers.
With the laser.
That's it.
Yeah.
If not, then patient need to undergo chemotherapy and radiotherapy.
And that's the only available option.
That is the available option. If it is bigger tumor that is coming, that is spread to the neck node,
that is it's all swollen because of that.
Swollen. It is locally. It is spread is there.
Spread is there.
Then the treatment remains the removal of voice box.
In that case, there's no other option. If you want to,
no other option.
If you want to save the life of that
Yes.
patient, you need to remove the voice box.
And I tell you, this is the most difficult job for us to counsel a patient and to tell.
And to make
if
him
I
agree,
operate,
make him agree
there will
or
be voice
make her
loss.
agree
You will not
that
be speak for
you
whole
won't be
life.
able to speak your rest of your life.
And second challenge, what we are getting is, we get few patients who are not even able to write.
How does that happen? Like, is it all
They're
related?
illiterate, no?
Okay.
See, these
Okay.
are villagers or from, they are,
Yeah,
I just
true.
said 50, 60, they're in the
So it's
They
very
do not know
difficult
how to
for
write.
you to actually,
Now you understand the pain. If a patient voice box is out,
how they'll explain themselves.
how they should
There's no way.
explain?
There's no way.
Usually, what we do till the
That's a
time,
challenge.
we usually give the digital chalkboard kind of, or slate, we call it as, so
So that they can
they
communicate
can
and they can
communicate by
tell,
writing. I need
yeah,
this, do this, that temporary for the time being. Usually we give that. But if a patient is illiterate, he doesn't know how to write. You imagine how difficult it becomes
absolutely,
communication.
doctor. That's quite of a sad scenario
Yeah.
that can happen.
So what we are doing is, even though we talk about removing the voice box, the relatives have reservation, patient have reservation, and all these patients, they will come again. They will postpone till the time the water crosses the nose, and then they will come for the surgery.
And by that time, they have already crossed the stage 4. I think the parameters
Yes.
far
So if
beyond
we
the stage
operate
4
also, again,
parameters.
I said the prognosis is compromised.
Right.
So this is a message we would like to give to general public, that if you have some change in the voice, and if doctor is advised for the surgical treatment, then they should not postpone it.
They should not postpone it. They should not
Immediately they
waste the
should.
time, because
Yes.
once the time is out, they will, they can't do anything about it. The
Yes.
time is the most critical parameter in every disease, and in cancer, it is, of course, the very, very important disease. And we
Yeah.
have been talking about it, that stage 1, stage 2 is the maximum you should wait. If you get diagnosed, do an early diagnosis and save your life.
Correct. And next, I'd also like to mention that we understand the patient's pain of losing the voice. So we could now give the voice processes at the same time. So we put there's a voice process available at the same time at the time of surgery.
Okay.
So patient can have some kind of robotic voice. He can speak something.
At least give some indication, some sound information,
Yes.
which
So it,
can
it will be
be
like a
uh,
robotic sound, but at least
can
the next
communicate
person can understand what he's
that
trying
what
to
he's
say.
trying to say.
So that is the availability of, we call the voice processors are available, and we do have the electronic laryngeal devices.
Which can be
So it's a small
incorporated.
battery operated devices. They just
Okay.
need to put it here,
Okay.
and that also produces the sound of a robot. Hi, mera naam Shakti hai. So like that will
Okay.
produce some kind of sound they can speak. You won't believe, but we have few of these the motivational speakers who speaks through this voice box. They address thousands of people in auditorium.
It's all externally placed,
No,
doctor.
they just have to put, they keep in a pocket.
Okay.
They take it out, put it here, they talk, they put it there.
Okay. So only while talking they need
Only
to
while
put.
talking they need to put it here. So that whatever they want to, and the beauty is, that produces a sound. If you want to speak in Tamil, Telugu, any language, that will produce a sound what he's trying to say.
Thanks to the technological advancements that we are having.
Yes. So there are many motivational speakers. One of my friend is there. He takes lectures at all over the world, and he talks with the electrolarynx,
Right.
setting an example to all the people around the globe that losing a voice box at saving your life is very important.
Very important. Very
If
important.
you want to preserve a life, a voice box, and losing a life, what is the use of it?
There's no point of, you know.
So I think that everyone need to understand who's viewing your this podcast. That life should be the first priority, and we are here to address your quality of life issues. It's not that we'll just operate and leave it alone. We will operate, but they need to understand that whether they have to save a life or whether they have to save a voice box. I think that decision is always taken by the family and the patient. We are not the deciding factor. We as a doctor can just guide a patient. Right. That you have option number 1. This is what if you do, this is the advantage you get. This is option number 2. This is what you do. This is the advantage. This is the disadvantage. Ultimately, who are the decision makers?
The family,
Is the
and
family.
definitely the
And
patient
patient will
at
be,
times.
patient. I've seen that majority of time, patient decision is taken by the family members and
In
not by
India,
the,
yes.
yes,
In India,
not by the
yes.
family, not by the
Absolutely.
patient alone.
Absolutely. It's always
So
the family,
it is
because without the
always,
family, how difficult it is.
yes,
Even the survival depends. Like, I really wish that every family member understands the need of such kind of treatment, especially if it's a cancer.
correct. And one more interesting thing I'll tell you, in decision making also everyone is afraid of making a decision also.
Yes.
Problem happens ki, especially if I tell you in our part of Rajasthan, everyone is afraid ki if I take a decision, take him for surgery and something happens, people will blame me
The
only.
blame is going to come on me that I was the one who pushed him for
Who
it.
pushed it? So that is also one of the things
one
wherein
of
they are
one of
not
a
able to
very
take a
very
decision.
yeah very very
Very common,
prominent and common
very
reasons
common
today,
problem we are going
that
to see.
if I will go and help, it might come on me that because of me or that particular family member, that crisis happened and the person is no more. But see, at the end of the day, we have to take a call, which is very important,
Exactly.
right? We can't just leave a cancer untreated. We have to take a call.
Yes.
And I really want to spread this message that more than the patient, the family needs to understand this,
Yes.
because they are the people who will help the patient in future, will support the patient in future for recovery and everything. So biggest support is the family. If
Yes.
family, they don't understand and they will not help, in decision making, it will be very difficult for that particular patient to even take a call if it
Correct.
is a cancer patient.
Yes. That is the reason that yesterday when we spoke about the complementary cancer care, we talk about the psychological counseling not only for patient but
For the
also for the
family
family,
too. Very important, doctor. Very important.
which is not happening in our country. Which is
But
not happening. It is less
I
than
I
1%.
think we can create awareness together
Yes.
through like similar podcasts and
Yes.
government initiatives. We
Yes.
can we
Yes.
can
We should.
by various collaborations we can do a lot if we really want to,
Yeah.
because I know India is growing, and we all like, and technology advancement is happening. Who knows that we'll have a replica of a voice box in future which can be just implanted and the person can again
Correct.
talk. So everything is possible in the era of AI.
Right.
I
You
wish.
rightly said. Yes.
I
Yes.
wish.
Hmm.
So with that, I think we are done with the voice box cancer
Yeah.
element.
Yeah.
And would you like to add something, or maybe we can talk about the thyroid cancer?
Okay. So just one more point. That is more of a medical purpose, but to just add on is that many times this voice box or the change in voice also happens because of some tumor in the chest,
Okay, how's that related?
lung cancer. Now that is very important thing. How people will relate
Mm.
that why lung cancer is giving change in the voice. There's nothing in the, if you examine this portion, there's nothing.
So it's all safe. The voice box is safe.
No, voice box is disturbed
It's
only.
disturbed, but
So
it's not
the
because of the cancer inside the voice box.
inside the voice box. So
Okay,
what has happened is now, as I said, the voice box moved like this.
correct.
One cord is paralyzed. Only one is moving half. So there's change in the voice, but there is no cancer as such in the neck region. So it becomes difficult, for a patient
To
or
further
even for a
diagnose.
doctor also for a
Yeah, to further
diagnosis
diagnose that what's the actual reason
or
behind
the
that.
actual diagnosis. So the reason is the your voice box, the nerve supply or the connection to the voice box, it always comes like it makes a loop.
Okay.
The nerve goes down and
Okay.
then it reaches upward to supply the voice box.
Okay. And where does this
This goes
node?
to brain.
Okay.
This goes to brain. There's a thicker nerve, and with that it gives a branch. So it makes a loop. If there is some problem in the lung, that voice box nerve is get compromised or that get compressed or that is got involved, then your half of vocal cord, one side of vocal cord will not work.
Okay. So it's basically
So
related to the lung. So if
related to
there is
lung cancers,
imagine it's an indirect effect.
indirect
It's an
effect.
indirect effect because somehow there is an infection in the lung. Because of
Yes.
that lung infection, that particular nerve
Yeah.
is getting, compromised, and because it is going to the voice box.
So many times
Imagine
what happens is a surgeon get a CT scan done till the neck region. They say, "यार सब कुछ तो ठीक है."
everything is all right. So that means we need
So
to go beyond,
we need to go and these kind
and we
of
need to check the lungs
diseases
as
are,
well.
sometime we need to get a CT scan of thorax or we need to get PET CT scan done for the assessment before we move ahead. So that is one of the point I wanted to make for the paralysis of vocal
Very,
cord.
very valid point, doctor. And
Yeah.
I'm really so happy that you are explaining it so minutely, because at times it is required. It is
Yes.
required because a lot of us, we don't know. We don't
Yeah.
know what it is, how it works. But when we know the severity of it, we understand it, and we understand and we get aware about that how important all these things are, because everything is related.
Correct.
Just now you gave a very example, a very valid example of that.
Yeah.
So, doctor, I think with that we have covered the entire, like, we have covered two topics. One is the throat cancer, and next
The voice
is the
box
voice box
cancers.
cancer.
Yes.
That was quite a lot of information that you shared with us today on throat cancer and voice box cancer. And I know we have a lot to talk, but I think we'll continue that in our next podcast. And thank you so much for joining us. We are
Thank you,
always,
ma'am.
always privileged whenever you come for our podcast. We know how value add you create for us as well as for the audiences. So thank you so much,
Thank you
Dr.
so much.
Shakti.
It's my pleasure to give my thoughts, my feelings to the general masses who can that can be really helpful to them, and we can save their family from going into this clause of this dreadful disease like cancer. So let's spread the awareness about the cancer,
Yeah,
and
because that's the mutual cause. We
that's
are
the
here
mutual
to spread
cause.
the awareness for our audiences. And any questions, if arises for the audiences, you can put it in our comments, and we will definitely get back to you. Thank you so much for watching us.